Welcome to today's webinar brought to you by OraSure Technologies. OraSure Technologies is a global leader in oral fluid substance abuse testing products. Their unique assays provide accurate and easy-to-administer testing methods to help determine the presence or absence of drugs or alcohol in a person's system. Oral-based testing products provide a simplified collection process, faster results, cost savings with minimal risk of tampering, and dramatically reduced risk of adulteration. The Intercept Oral Drug Test is an FDA-cleared laboratory-based oral fluid drug testing system that enables accurate testing for 9 drugs of abuse, including marijuana, cocaine, PCP, amphetamines, methamphetamines, barbiturates, benzodiazepines, methadone, and opiates. It was ranked as the #1 recognized brand name in oral fluid testing in a 2015 National Drug Testing Industry Survey. With a fast and easy-to-administer collection process, Intercept is ideal for workplace, criminal justice, drug treatment centers, the clinical setting screening program, among others. Today's presentation is entitled Making a Case for Lab-Based Oral Fluid Drug Testing and will be presented by Bill Current and a panel of IEC representatives. Bill Current is the president and founder of the Current Consulting Group, a national consulting firm that specializes in drug testing policy development. He is the publisher of the online Ultimate Guide to State Drug Testing Laws at statedrugtestinglaws.com and the publisher of the e-newsletter State Drug Testing Laws Monthly and the weekly e-news service Drug Testing in the News. Judy Swartley is the president of Red Planet Substance Abuse Testing, who is our co-host for this webinar today. Red Planet Substance Abuse Testing is a leading provider of drug and alcohol testing services to many industries, including the construction industry. Judy has been involved in substance abuse testing since 2000. She has served as the safety director at a mid-sized contracting business, worked in heavy manufacturing as the QC manager of a 4,200-person facility of Honeywell, and has taught at Lehigh University and Penn State University. Joining us on our IEC panel is Sheila Spurla as the executive director for the Greater St. Louis, Missouri chapter of IEC and has been in this position for 17 years. Sheila was instrumental in implementing the use of Intercept lab-based saliva drug testing at her chapter back in 2004. Tina Whitebear is the Manager of Education and Training for the Greater St. Louis, Missouri chapter of IEC and has been in the position for 14 years. In this job, she's been responsible for the administration and management of Intercept drug testing since 2004. Grant Schmelzer is the Executive Director for the Chesapeake, Maryland chapter of IEC, which encompasses Delaware, Washington, D.C., Maryland, Virginia, and West Virginia, and Eastern Pennsylvania. He's been in the position for 20 years. Grant has been responsible for the rapid growth of his chapter and is a big proponent of the Intercept drug testing. We will now turn the time over to Bill Current.
Well, thank you, Jessica, and welcome to everyone who is on today's webinar. I'm really excited to be participating in yet another webinar co-sponsored by both OraSure Technologies and Red Planet Substance Abuse Testing. We've done a number of webinars with both companies in the past, and we've really, I think, kind of brought a unique element to today's presentation. As Jessica mentioned, we have a panel of representatives from IEC, the Independent Electrical Contractors, and we're going to bring them into the discussion a little bit later on and get a little bit more of a real-world perspective. We're going to talk about lab-based oral fluid testing, of course, and we're going to go through various sort of misconceptions about lab-based oral fluid testing. We're going to, sort of set the record straight, if you will, but we're also going to talk about it from a very practical standpoint. As some of you may be aware, the federal government last year, the Substance Abuse and Mental Health Services Administration, issued proposed guidelines for lab-based oral fluid testing. We expect those, we expect those proposed guidelines to be finalized and published sometime in the sort of March, April, May time frame. And this is a major development. Essentially, what is happening here is that for the first time in nearly 30 years, the federal government is endorsing another drug testing method. So for many years, the only testing method that was permitted, not in every federal government situation, but say, for example, in transportation under the DOT regulations or the Nuclear Regulatory Commission, et cetera, or the testing of federal employees by federal employers, has been limited to urine drug testing. And so as these more advanced testing methods have come into play, i.e. lab-based oral fluid testing, the government has not allowed the use of these testing methods until now. So for the first time in many years, we're now seeing the government moving to allow the use of a different testing method. So this is very, very big news in the drug testing industry and for employers as well. The initial version of these proposed guidelines will only apply to federal employers, federal agencies testing federal employees. But the U.S. Department of Transportation has already signaled that once those guidelines are finalized, they will begin the process of looking at implementing them into the DOT-mandated drug testing regulations as well. So we can see a lot happening there. We do a survey every year in our company, Current Consulting Group. We've been doing it for the last 17 years. And I'm going to refer to some of the data that has come out of that survey over the last couple of years as it pertains to oral fluid testing. To start with, I think most people who employ drug testing, who have been subject to drug testing, who have looked at all the different things that the government has tried to do over the years to reduce or eliminate drug abuse. The one thing that's really worked is drug testing. It is proven to be a very effective way to identify people who need help and to deter people from using drugs in the first place. So the question is not whether or not to do drug testing. The question is really more, what's the best way to do drug testing? How can I get the most out of my drug testing budget to make sure I'm accomplishing my drug-free workplace objectives? And that's what we're going to talk about today. We're going to talk about one particular alternative to the traditional lab-based urine testing method. I think you're all familiar with that process. You collect a urine sample, typically at an off-site collection facility, transport that sample to a lab. An initial analysis of the sample is conducted in the laboratory. If the result is negative, it gets reported out. However, if it's non-negative, if it's positive in that initial screen, then it goes through a confirmation testing process. And that result becomes the final result, goes to a medical review officer who attempts to verify that the result is in fact accurate. And then, once the result is verified, it gets reported back to the employer, to the testing agency. So each step of that process has time and dollars associated with it. And this is sort of what I showed you just on the previous slide in more of a graph type format here. But the collection site experience takes up to a couple of hours, sometimes more, depending on the circumstances, to send somebody to an off-site collection site. The sample gets shipped overnight to a laboratory. It gets analyzed. If you follow the route over there to the left, if it's negative, then it gets reported out as a negative result. If it's positive or non-negative at that point, follow the trail to the right there. You see that it's then going to go through a confirmation testing process, the MRO verification, et cetera. So the entire process takes time, and each phase of the process, the collection, the analysis, the MRO, et cetera, that all costs money, of course. And the dollars can, be all over the place, right? Lab-based oral fluid testing, on the other hand, is growing in popularity, I believe, because, one, it's not urine. A lot of companies are uncomfortable testing with urine, even though they've had to do it over the years. It's nearly impossible to cheat on an oral fluid test, and I'll explain why in a little bit more detail coming up here in a few slides. Because it's a lab-based test, it does result an accurate result that is very, very similar to a lab-based urine test result. And best of all, perhaps, depending on what your objectives are, it reduces the time that it takes to conduct a drug test. So there's time that's reduced, and there's cost that's reduced. And we'll go through and look at those. But there's a big difference between lab-based oral fluid testing and lab-based urine testing. Now, as I mentioned, we conduct a survey every year of the drug testing industry, and we ask questions of the survey participants. And this is a sampling of some of the comments that we received regarding lab-based oral fluid testing. Quote, when oral fluid testing is finally in 49 CFR Part 40, we feel the oral fluid requests will skyrocket for the non-regulated industry. Quote, we'll see movement if SAMHSA comes out with regulations. Then we'll see it take off. Quote, there are a lot of advantages, but some clients still want to use professional collections. And then, quote, there appears to be more interest in oral fluid. Last year we processed 830,000 tests, and 12% of that was oral fluid, mostly from one large customer. These quotes came before SAMHSA put out the proposed guidelines. So now we're starting to see that process unfold, and the predictions that you see here in the first couple of quotes in particular are now going to start to come to pass. We're going to see an increase in interest in oral fluid testing, an increase in the number of companies doing oral fluid testing. In fact, as part of those proposed guidelines, SAMHSA projected that eventually, over the next 4 or 5 years, once the guidelines are finalized and they're in place, that 25 to 30% of all non-regulated drug tests will be lab-based oral fluid tests. So we're going to see a shift toward lab-based oral fluid testing in the United States, something that, quite frankly, has already been happening in other countries, where oral fluid testing and hair testing, for that matter, are both very popular in many countries in Europe, Australia, especially in Australia, for example. Oral fluid testing is the testing method of choice. And this is true in other countries, or it's more true, I should say, in other countries. Not all countries, but many countries have looked at these advanced testing methods like oral fluid, lab-based oral fluid, and hair testing as viable alternatives. And in the United States, we're somewhat encumbered by those federal guidelines, even though they don't apply in a quote-unquote non-regulated setting necessarily. We're still sort of encumbered by this federal standard. Now, we asked the survey participants in last year's survey what percentage of all drug tests today are oral fluid tests. 25% said 55% or less. 29.5% said it was between 5 and 10%. 9.8%, 10 to 15%. So in other words, 9.8% of our survey respondents said that the percentage of all drug tests was between 10 and 15%. 8.4 said it was 15 to 20, and 2.8 said it was over 20%. Look at that bottom number there, though. 23.9, almost 24% weren't really sure. A lot of education still going on in the drug testing industry. We also asked about sales specifically, because if you're in the drug testing business, that's, the bottom line is always the bottom line, right? So how do sales in 2014 compare to 2013? Sales are up considerably. 12.8% agreed with that statement. Sales are up modestly. 24.2% agreed with that statement, for a total of 37% saying that sales are up between modestly and considerably, and 22.8%, as you see there right in the middle, say sales are about the same. Now, all of this is relative, right, because we don't know how many drug tests are being sold, but a fairly significant percentage were indicating that sales of oral fluid testing was up from one year to the next. So that's important, and only a small percentage, 2.8, altogether said sales were down slightly or considerably. So the results are telling in the sense that even before the SAMHSA proposed guidelines came out, we are starting to see growing interest in lab-based oral fluid testing. Yet, at the same time, some of the common myths and misconceptions, misunderstandings about oral fluid testing still persist and are out there today. Lab-based oral fluid testing is inaccurate. The window of detection is too short. You can't detect marijuana with oral fluid testing. It's just as susceptible to cheating as it is as with urine. It's not an FDA-cleared testing method. It's just too hard, too complicated to switch from urine to oral fluid testing, and there's no return on investment. Done a lot of research on this, and I'm going to share some of this with you now. I'm going to kind of go through it quickly, though, because I want to make sure that we get to our panel discussion, and we leave ample time for Grant and Sheila and Tina. So I'll go through these quickly, but let me say you're going to have these slides. After this survey is over, Jessica is going to send an email out to everybody who is on today's presentation, and you will have access to these slides in their entirety. If you have any additional questions that we don't answer today, let us know after the presentation's over, after you get the slides. If there's something missing you want to know, just email us, and we'll help you get that information. Now, as far as accuracy goes, we're essentially comparing one technology to another. So in this case, because urine is the most common drug testing method, we're comparing lab-based oral fluid testing to lab-based urine testing. And let me clarify here at this point that all throughout today's presentation, almost without exception, we're really talking about lab-based oral fluid testing. We're not talking about instant result, rapid result, on-site, POCT, point-of-care, point-of-collection testing, the instant disposable devices. That, we're not talking about that. I will make reference to it coming up here in a couple of slides. But we're talking about lab-based oral fluid testing. And the truth of the matter is, in terms of sort of assessing someone's behavior or job performance or their risk of causing an accident in the workplace, lab-based oral fluid testing may have greater relevance than urine testing. The presence of drugs in an oral fluid sample is usually, as you see there underlined, is usually related to the amount of drugs in the bloodstream at the time the sample was collected. An oral fluid test is a blood equivalent test. The result from an oral fluid test is equivalent to the result from a blood test. The scientists in our industry will all tell you that blood is the gold standard, but not very many companies are going to use blood to test their employees for drugs. And in fact, in some states, if you look at the state drug testing laws, it's not legal. It's prohibited to use blood as your testing method. But oral fluid mimics or is equivalent to blood when it comes to detecting drugs in a person's system. So in other words, you're getting the best of the sort of the blood testing method without actually drawing blood. The reason for this is that oral fluid tests for the parent drug and not just a metabolite of the drug. So the parent drug is the drug. It's the drug inside somebody's system. The metabolite is a metabolic breakdown of that drug, and that takes time for that to process in a human being system. But because oral fluid can detect the parent drug, it's detectable almost immediately after somebody uses a drug. There's no wait time for the metabolic process, the breakdown process to occur. So the advances in the technology of oral fluid testing over the last several years has made it possible to accurately say that the accuracy of lab-based oral fluid testing is equivalent to blood and just as good, if not better, under some circumstances, depending on, again, what your objectives are, than with urine. Accuracy of a device, though, is a different issue. In other words, you want to find a device that can perform and produce the type of results that we're talking about here today. And so generally what I do is I advise companies to, if you're considering switching, I advise you to look for and have the provider that you're going to be dealing with provide some independent empirical data from some peer-reviewed journals, for example, peer-reviewed publications, so that it's not the drug testing manufacturer that's making the claims, but it's an independent review of the product's performance that's published in a peer-reviewed journal that you find the claim. In addition to that, look for an FDA-cleared product, the testing device, as well as the testing system, and I've got a slide coming up on that here pretty soon. You can ask for referrals, references, and find out other people in your industry who are using this product, a particular product that you're looking at. You can also do your own internal research. You can ask for samples of the product that you're looking at so that you can put it to the test yourself. And all of these products come in a package with what's called a package insert. And that package insert is, a piece of paper with a lot of small print on it that tells you what you can expect in using this product. Read that information carefully and then put those package inserts to the test as you're doing your own internal research. And then, of course, always know who you're doing business with. Companies that have been in the drug testing industry for a long time are still in the industry because they've got the satisfied customers, They've got the expertise to be able to help you, as opposed to a lot of new companies getting into the drug testing industry on a regular basis. Now, detection times. This always comes up. The drug transfer to oral fluid from blood occurs as long as the drug is in the bloodstream, right? Because remember, I told you it's going to yield a blood equivalent type of test. So as long as the drug is in the bloodstream, it's going to be detectable in oral fluid. So the detection times start literally within minutes after somebody has used a drug. And that detection window stays open for as long as the drug remains in the bloodstream. So comparing urine with oral fluid is easy because over a comparable period of time in terms of this window of detection, when the drug is detectable in urine and oral fluid, during those times where those windows of detection between the two testing methods overlap, you're going to find very comparable accuracy results. And I've got a slide I think coming up here. Well, I know I do that would actually show that. But let me speak to the window of detection just for a moment, because this comes up a lot. With oral fluid testing, you're going to be able to detect drug use almost immediately after somebody has used a drug. With urine testing, there's going to be a lag time. There's going to be a gap between the time when the person used the drug, let's say marijuana, before it's detectable in a urine sample, because it's got to go through the metabolic breakdown process. So you're going to be able to detect the marijuana in an individual with your oral fluid test immediately after they've used the drug, and you're going to get some positives that way on the front end of the window of detection that you're just simply not going to be able to get with urine, because there is that gap between usage and when the drug becomes detectable in a urine sample. Now, the window of detection will stay open a little bit longer with the urine than it is with the oral fluid, but the period of time in which those two windows of detection overlap, you're going to see very comparable positivity results. In fact, let's go to that right now. This is the chart I was referring to earlier. So this is data from an analysis of over 4.5 million drug tests using the Intercept device, as you see in the small print underneath the graph, comparing it to urine testing at one major laboratory. So Intercept is the middle column, but let's refer to it as lab-based oral fluid testing. And then the third column over under urinalysis is lab-based urine testing. The overall positivity rate comparing millions of drug test results from oral fluid and urine is almost the same, 4.1% positive for the lab-based oral fluid testing column and 4.4% for the urine testing. Now you can see that if you go down the line, amphetamine was where urine testing got its big lead over oral fluid testing. But as you go down further, you see that oral fluid testing produced greater positive percentages in all the other drug testing categories. What's interesting is that if you go down to, about the sixth one down, you see THC. That's the psychoactive ingredient in marijuana. So when people say that you can't detect marijuana in an oral fluid sample, that's simply not true. And in fact, at least in this study, the positivity rate for THC in lab-based oral fluid testing was slightly higher than with lab-based urine testing. So the positivity rate overall, very, very similar, higher with THC, marijuana, of course, which is the #1 drug abuse in the country, or drug being abused in the United States. And you can find that information in a number of different government websites. The one that I like is called the National Survey on Drug Use and Health. And if you do a search on that, National Survey on Drug Use and Health, you can find a lot of data on the prevalence and the magnitude of the drug problem. Marijuana, can you detect it? Of course, I just showed you how you can. But a couple of things to keep in mind, okay? Marijuana is typically detectable in oral fluid almost immediately after somebody uses the drug. So if somebody goes on a lunch break and they come back smelling of marijuana, if you test them with an oral fluid sample, and they were really using marijuana, they're most likely going to test positive. It just depends on the number of factors, which I'm going to show you here in a second. If you collect a urine sample at that point, and they used marijuana within the last say 30 to 60 minutes, you're probably not going to get a positive. So in other words, you have reasonable suspicion based on maybe the behavior of the individual and the way they smell, et cetera, having come back from a lunch break. With an oral fluid test, they're almost 100% guaranteed to test positive because that window of detection opens up immediately. But with urine, you're probably, you know, if it's in the last 30 to 60 minutes, thereabouts, let's say last hour, they're probably not going to test positive. So you're going to get positives on the front end of that window of detection, like I talked about, with oral fluid that you're just not going to get when it comes to urine testing. Now, testing methods make a big difference. And now I'm going to talk about point of collection, instant result, oral fluid testing. There's a huge difference between the technology and the science behind lab-based oral fluid testing and point of care or point of collection, the disposable devices that render an immediate result right there. The cutoff levels for POCT oral fluid testing are much higher, and with lab-based testing, whereas you're mimicking blood, you're looking at cutoff levels that are very similar to what you would use in a laboratory with urine testing. That is not the case when it comes to POCT or instant result testing. So here's a chart that kind of exemplifies what I'm trying to say. To the left of the vertical dotted line are the positives for THC at 50 nanograms per milliliter cutoff all the way down to 5 nanograms per milliliter, okay? So you can see that 80% of all the positives are below 50%. And to take it one step further, just let your eye go to the left there, and you'll see that the majority of that 80% are less than 25, even less than 20 nanograms per milliliter as a cutoff level. And the biggest category is at about 5-10%. So if you're testing with a device that has a very high cutoff level, 5 nanograms or 50 nanograms or higher, you're just not going to get the positives you think you're going to get with oral fluid testing. But if you're using a lab-based testing method like Intercept and you've got these lower cutoff levels, you're going to catch those positives. I mean, they're going to be there because the technology is capable of detecting at these lower cutoff levels, whereas with the instant testing devices with oral fluid, the technology is just not there. And that's one of the reasons why SAMHSA is only looking at lab-based oral fluid testing, because it has the accuracy and the integrity in the science to match up very well with lab-based urine testing. One of the big advantages to oral fluid testing, this was something highlighted in those SAMHSA proposed guidelines, is the whole drug test cheating issue. It's just a big problem when it comes to urine testing because urine testing is so susceptible to various cheating methods, whether we're talking about adulteration, switching, adding something to a device, bringing in a fake urine sample, through all the different methods that are out there. They just don't work when it comes to oral fluid testing. And one of the main advantages with oral fluid testing is that every single collection is 100% observable. Whether you're collecting it yourself or one of your trained employees is doing it in the workplace, or you're still using a professional technician to oversee that collection process, the collection is observable. The donor and the administrator of the test are standing right in front of each other. There's no way for somebody to do anything, really, to cheat on the test. In fact, I've done a little bit of research on this, and there's a whole lot more out there. I mean, if you do Beat the Drug Test, you do a Google search on Beat the Drug Test, you'll find over 1 million different possible websites where you can find information about cheating on a drug test. When it comes to finding information about cheating on an oral fluid or a saliva test, the best advice that anybody will give you is try to avoid the test. I mean, that's a direct quote from a website. Avoid submitting saliva. And then down below, between certain periods of time, you must avoid being screened or you will surely test positive. In other words, the best thing you can do to get by on an oral fluid test is just stop using drugs or don't let them have your saliva because you're going to test positive. Because the typical testing methods that are out there today just don't work with oral fluid testing. You can do lots of different things to try to thwart cheaters when it comes to urine testing, but a lot of that adds to the cost and infringes more on the privacy of the individual. If you're observing a urine collection, that can obviously be a very uncomfortable situation for the donor as well as for the administrator. You just don't have any of those issues when it comes to oral fluid testing. All of that is virtually eliminated when it comes to oral fluid testing. So if you're in an industry where that is a particular concern, and that is one of the main reasons why a lot of companies cite for switching to oral fluid testing. You're going to find that with oral fluid testing, like this Department of Corrections organization in Iowa found, is that all of that just goes away. They dilute specimens that are very common in a urine testing program. Just, of course, don't happen because there's no way to dilute the oral fluid sample. So if you look to the left, this particular organization was experiencing about a 5% dilution rate. In other words, about 5% of their samples were diluted in one way or another. They were dilute specimens. But once they switched to oral fluid testing, of course, that went away entirely. And that's something that you're going to see quite a bit. Now, I've got a few slides that maybe I can come back to here. FDA clearance, I should say, is a very important subject. Let me spend just a minute on this, and then I want to bring our panel in. If you're going to, trust your drug testing program to a new testing method, like you're looking at switching from urine to oral fluid in this case, then you really owe it to yourself to not settle for anything less than an FDA-cleared device. But it's not just the device, not just the collection device where you're going to collect the oral fluid sample that needs to be FDA-cleared. It's the testing system itself in the laboratory. So the collection device must be FDA-cleared, and the testing system must be FDA-cleared. In other words, the drugs that you're testing for have been FDA-cleared. So as Jessica mentioned at the beginning, this is a sample of the OraSure Intercepts list of drugs that are FDA cleared as part of their testing system. You can check other ones, in addition to this, but this is the testing method with the most drugs or assays that have been FDA cleared. The point I'm trying to make here is that it's just too important to make sure that the integrity of your testing program is unimpeachable. So you want to make sure that the device that you're collecting the oral fluid sample with and the testing system and the assays in the laboratory are, in fact, FDA cleared. That is the gold standard. You want to make sure that that is the case, no matter what testing method you use. Even if you're sticking to your traditional age-old urine testing program, you want to make sure that you're dealing with FDA-cleared processes and devices. Now, let me advance here just a little bit because I want to make sure that I don't overspeak too much and I cut out Grant and the others. So let me take this one step further. I had the opportunity several weeks ago to meet with some representatives from the Independent Electrical Contractors Association. These are people who are, the folks that we have on today's panel, are people who actually are involved in the drug testing programs of the chapters that they're responsible for. And so what I'd like to do now is bring them into the discussion, and let's just make sure that their microphones are unmuted, Jessica, if you will. I see Grant is still muted. And we're going to start with Grant. Now, we did have the possibility that I think it was it Sheila, I think, was possibly going to be late to today's call. I don't know if she made it, but let's go ahead and go forward, Grant.
Sure.
I saw Grant's bio, but let me put it back up on the screen here. Grant is the executive director of the Chesapeake, Maryland chapter of the IEC, and that takes in, all, as you see there in the middle of his bio, several states plus the District of Columbia. Grant, tell us a little bit about your experience with drug testing and with the lab-based oral fluid drug testing in particular.
Sure. So we as a chapter, we have about 150 different companies that are affiliated with the association, and because so many of our companies that are affiliated, we don't actually do the drug testing. Our companies that are members do it because we have a lot of repetition with the federal government requirements. So several of our contractors, and that number continues to grow, work with Judy in order to meet their reporting requirements for their federal contracting, for their federal contracts. So for us, it's been about how do we become more efficient, how do we get the best results, because for a lot of our businesses, it's I need to hire tomorrow, and I need them on the job the next day. So we have found, and the feedback that we've gotten from our participating members is that this has helped create a speedier process and then a more efficient process from a business standpoint for them.
Okay. And how long, what's your experience now? How many years have you been working with lab-based oral fluid testing?
Judy helped me probably, 6 years now, 5 years, somewhere, if not longer.
Yeah. So you've got enough years of experience with it to be able to, tell the difference between urine and oral fluid testing. What, in addition to sort of the efficiency of the process, what are some of the advantages that you've experienced over the last 5-6 years?
Well, I think the challenge over the last few years, and you talked about it, Bill, during your presentation, was it's becoming more widely accepted, especially now that there is, more data and research on it as well, that companies and or providers are becoming more comfortable with that. So that was the challenge initially that many of our contractors ran into. And like anything else that's new, there's always that, I'll call it a probationary period, where the results aren't in, and now that there's years of data, I think that's really helped it become more accepted. Now,
were there concerns beforehand? I know I brought up several issues like the window of detection, the ability to detect for marijuana, but drug test cheating in particular. Were there concerns about drug test cheating in the old days? Has that been addressed with oral fluid testing from your experience?
Oh, absolutely. I mean, because of it's done right in front of the company's eyes, it just doesn't leave that that suspicion, let's call it, that exists out there. So the company feels better, and at the end of the day, I feel like all of our employers, and I know a couple are on the phone because I saw the attendee list. I think that they feel, better about seeing the process, because they're responsible for all the other employees' lives out on the job sites, especially in construction. It's a dangerous industry, and they want to make sure all their employees get home to their families at the end of the day.
So there's really no concern among the employers you're working with in terms of whether or not it's an accurate testing method. It works in terms of the science then?
Correct.
Now, let me ask you one other question, and Jessica is checking to see if Sheila and Tina have been able to make it on the line. And I don't know how you answer this one, Grant, but from the perspective of an individual who's subject to the test, have you any kind of idea or feedback that they didn't realize they were going to be tested with oral fluid, and then once they are, they whatever they were planning to do to cheat on the test, they realize it's not going to work. Have you had any of those types of experiences?
No, I mean, in the old days, or it's still current, but employers would send the individual out to the testing facility. So that's the one thing that's probably changed is that I have heard a story of once or twice of somebody who's going to be tested by the employer right there on the spot, and they go to the bathroom and they never come back, versus them being sent out to a testing facility, they just never show up. So I haven't heard a lot of those stories versus the old story of hey, we like this employee, we sent the employee or potential employee, and we sent them out to go get drug tested, and they never showed up. Yeah. I think that's one of the things that the employers like, that they kind of know where they stand, because if that employee doesn't show up for and get tested, they're kind of sitting there and they're still tracking down that potential employee at that point in time.
What are some of the you saw me or heard me go through some of the sort of the lingering misconceptions about oral fluid testing, that it can't detect marijuana or that it's subject to cheating or, this, that, and the other thing. Do you still hear the employers that you work with that some of these misconceptions are still lingering out there?
No, I mean, the biggest challenges, I'll say, facing employers, because not only do we work in the geography that's provided in my bio, we have companies that work nationwide. So with 4 states now having marijuana legalized, that's the bigger challenge that employers are dealing with. And I know with Maryland coming online soon, and some of the requirements in D.C., I think that's the challenge that most employers are facing. And the one thing that I would say is, to give Judy a little bit of, Judy's just such a tremendous resource, and I think that's the other thing that our employers love about the program, is that they have Judy, and I know you and your team there supporting and dealing with these issues, because it's constantly changing. And when you're working in multiple states, keeping up with it all, I know from the HR perspective, it becomes very, very challenging.
Yeah, absolutely. You're, talking about the drug test cheating issue. It reminded me of a webinar I did last year with somebody in the criminal justice field, and she was sharing as part of the presentation that an individual came in to take the drug test. This would have been a parolee, and when he realized that they were going to do an oral fluid test instead of a urine test, his girlfriend, who was with him, who was pregnant, suddenly went into labor, and that was his excuse to leave at that point. He
and the dog ate your homework, and
yeah. But he brought his pregnant girlfriend with him, and she was ready to go into labor if need be. So, but a lot of that kind of stuff does happen. Different cheating methods that that are very common with urine testing. Adding bleach to your urine sample, or bringing a substitute urine sample into the bathroom stall with you through some nefarious means. It just doesn't translate to oral fluid testing. You can't really sort of smuggle in somebody else's saliva. It just doesn't work that way. So usually people who realize that they're going to be subject to oral fluid testing sort of give up at that point. And I guess that's the main thing that you were getting at, Grant, is that, if you're trying to deter individuals from using drugs, and you're using a drug testing method that, is just simply not subject to, the common drug test cheating methods, then I guess you're achieving your basic objective, which is to deter people from using drugs. And I suppose to some extent, you tell me, Grant, but with the pre-employment testing process, some people might just turn around and leave if they see that they're going to be subject to a drug test.
Mm-hmm.
That becomes the deterrent. So.
Yeah, I would definitely agree with that.
All right. Now, I am waiting for the signal from Jessica to see if Sheila and Tina are on the line. I think they are on, but we're not seeing their phone hook up. So, Grant, stay tuned. Stay close by.
Okay.
We may need you again. And while she works on that, let me take our audience to a couple of slides that I skipped over. Let me go back up to slide number 35. There is a story of a company. We call them stories from the field. This was a company in the construction industry by the name of Seco, and they switched back in 2004, actually 2004-2005 range. They switched from a traditional urine testing program to lab-based oral fluid testing. They were using the OraSure Intercept device, and they still are. And the main reason they wanted to switch, and maybe, Grant, you can address this from your world, is that only a third of their employees actually worked in the office there at the headquarters. The rest were out in the field on job sites on a regular basis, and it was very impractical, and it could be quite expensive to try to conduct urine tests with 2/3 of your team out in the field on job sites. Do you find that to be the case as well from your experience, Grant?
Yeah, I mean, and sometimes these These job sites, I mean, they're far, far away.
Yeah.
There's one in the middle. I can think of one right now. One of our contractors it's in the middle. It's almost on the Virginia North Carolina border, and there's nothing for miles and miles. I mean, in the construction industry, you know, the infrastructure is generally being built up. So in order to send your employees out to go to a facility, it becomes logistical. It becomes very difficult logistically.
Yeah. So oral fluid testing addresses that issue then very nicely. If you go down to that third bullet on the screen right now, this is a quote from Shannon Costill. She's the HR and Special Projects Coordinator for CEQA. She said, with Intercept, and of course she's referring to lab-based oral fluid testing, we're able to efficiently obtain the testing samples where we work without having to drive to another facility and wait in line to collect a urine sample. And that can be a time-consuming and ultimately costly process if you're taking people off the job at some type of a remote work site and sending them to an Occ Health Center, a hospital, or some other facility where they're going to provide a urine sample. And sometimes that can take, you know, certainly an hour, could take a couple hours, 3 hours. I remember one time I was making a presentation years ago to an audience of construction company representatives, and I asked, how long does the collection process take? I mean, those of you who are using urine testing, how long does that process take? And this one lady raised her hand. She was the president of her own construction company, and she said that sometimes her employees will be gone for 2 hours for sure, but sometimes longer than that, 3 hours or more. And what they discovered was that because they were sort of offline there, they were stopping at a bar on the way back to wherever their work site was, and they would come back smelling of beer because they'd taken an extra hour under the guise of being at a collection site providing a urine sample. And sometimes people will take advantage of the process, but sometimes just the process of driving to an off-site collection facility and waiting in line, et cetera, can be quite time-consuming. Shannon went on to say taking a mouth swab is a more dignified way to conduct drug testing compared with taking a urine sample. Our team members appreciate the convenience and the ease of this product or this testing method. And then she added at the end, in terms of employee drug testing, convenience and flexibility are very important to us. And Intercept is able to provide us with these benefits in a way that other drug testing methods are not. We would recommend Intercept lab-based oral fluid testing to any company that wants to save time, offer increased convenience and flexibility, and still achieve highly accurate results. And I guess in the end, Grant, it really does come back. It comes down to the results, right? The results have to be accurate if your program's going to work.
And they have to be compliant with the, you know, especially in the federal or state level world, they have to be, you know, meet those requirements that the customer wants.
Absolutely, and you've had to, I guess you've had to address those issues over the course of time then.
Yes.
They want an assurance that a testing method is going to work and that they're not sacrifice anything in the process. You know, it might be a good idea. Let's take a question because there's one that's sort of, and I'd like to ask you part of this question, Grant, but somebody submitted the question about alcohol testing. Do you also provide alcohol testing or help companies with alcohol testing programs?
Do we as IEC?
Yeah, in addition to drug testing.
No, we haven't had that request. That's interesting though. I feel like because you can almost go out and buy handheld breathalyzers and things like that, that there's a way to do it. I don't know what the insurance ramifications of that or employment ramifications for documentation purposes.
Yeah, that's an interesting response. What a lot of people don't realize is that under the federal drug and alcohol testing regulations, alcohol testing is limited to devices that are on what's called the Conforming Products List, which is issued by NHTSA, which is the National Highway Traffic Safety Administration. So now, not all non-regulated testing has to conform to, you know, the federal guidelines, but what a lot of people don't realize is that a lot of state laws simply punt on this issue. They just simply defer to the federal guidelines and regulations when it comes to the testing methods. So you'll be in a state and you're not a, say, DOT-covered employer, but in that state, the law requires you to test in a way that is consistent with federal regulations, even though you're not, as I said, a DOT-covered employer. And when it comes to alcohol testing, you can, under those circumstances, you can only use a product that is part of the conforming products list. So we're now getting to the point when it comes to lab-based oral fluid drug testing where we're going to have something like that. I'm not exactly sure what it's going to look like, but there will be a standard that has to be met by any lab-based oral fluid testing method, the collection device, and the testing system in order to be compliant with these new federal guidelines, which they're not finalized, so I'm not predicting what that process will be or what those approvals will look like. But we're probably going to see something like that, and you'll be in a position where, and of course the OraSure Intercept device would be within the safe boundaries of any type of standard that would be required. And there'd be other testing methods as well, other products as well. But when it comes to testing for alcohol, you may still find yourself in a position, because somebody asked if you can test for alcohol through Intercept. OraSure actually produces a product called QED, which is a saliva alcohol testing product. And it's saliva-based. It's not breath, which you see with a lot of, say, DOT alcohol testing, for example. But the vast majority of states allow saliva alcohol testing. And if you're looking for a product that's on that conforming products list, something like the OraSure QED device, which again is saliva-based, just like their drug testing system, would be on that conforming products list. So an answer to that question. Somebody also asked the question, and Grant, you must deal with a lot of different laboratories. They asked which lab will process the Intercept test. There are actually quite a number of labs that work with OraSure and will process saliva samples that are collected with the Intercept device. I would leave it to Judy to answer that question for you offline. Judy Swartley from Red Planet Substance Abuse Testing, she would be able to give you more specifics on that. Do you deal with various laboratories, Grant, or is it just one lab that you're typically working with?
Yeah, I would need to defer to Judy because she does the coordination with the employers at the end of the day. So Judy's my go-to when it comes to those type of administrative, functionality questions.
Absolutely. So, and Judy I'll have some contact information for Judy at the last slide on today's presentation. Before I get to the last couple of questions that we have that have been submitted, these are some of the advantages here. One of the questions I often get asked is, I've heard it's illegal to do oral fluid drug testing in my state. Well, if you're not in Vermont or Maine or actually, there's some controversy when it comes to Maine. So we put 48 states, Vermont and Hawaii. Hawaii actually does allow instant oral fluid testing, but the technology, as I mentioned earlier, is very different than lab-based oral fluid testing. And then we typically have Maine on the list, so it fluctuates between 47 or 48 states that don't allow oral fluid testing. But Maine is actually in the process of, they have already said that they will adopt these new federal guidelines for lab-based oral fluid testing once they're finalized. So the list of states that don't allow oral fluid testing is basically coming down to one or two, Vermont and Hawaii, depending on the testing method that you're using. But I wanted to make sure I addressed that because I usually have slides on it. I didn't have slides on it today. But if you're here in Florida where I live, you're up in Pennsylvania where Judy's company and where OraSure are headquartered, and virtually every other state with the exception of Vermont and Hawaii, possibly Maine, for a little bit longer until those final guidelines come out. You can do lab-based oral fluid testing. And when I say that, I do want to underscore that if you're thinking about doing instant result oral fluid testing, you need to check not just the state drug testing laws that pertains to laboratory testing, but as it pertains to instant result testing, because there are a number of states that do not allow the use of instant testing devices, so whether it's oral fluid or urine. So you just need to check and make sure on that. We did have another question that was submitted. This is an interesting question. I've heard one way to cheat on oral fluid tests is the brush teeth and rinse mouth with a neutralizing mouthwash. Is this true? That's an interesting question, and there's no, and I've heard it before, we've looked into it, there's really no scientific evidence that these quote-unquote neutralizing mouthwashes work. There are a number of websites that will sell you that product, and typically, and this is no lie, I mean, you know, the idea that there's a sucker born every minute, right? Typically on these websites, they will sell you this neutralizing mouthwash product, but they will advise you to stop using drugs for at least 1 or 2 days prior to being tested. So in other words, yeah, buy our product, spend $40 for this mouthwash, but just to be safe, stop using drugs. And then we can guarantee that you're going to pass your drug test, that your oral fluid drug test is coming up. Anyway, a lot of information like that is out there on the internet. As I mentioned, you're going to get today's slides. You can contact OraSure, or you can contact Judy Swardley at redplanettesting.com or at 610-509-0567. If you want to ask Judy questions specifically, she works with IEC and folks like Grant and Tina and Sheila and others as well. And if you have any other technical questions, you might want to contact Judy or somebody at OraSure. Just in conclusion, let me just say that I've been in the drug testing industry for a long time, over 25 years. This is probably the most exciting period of time that I've experienced as in the drug testing profession, just because of the advent of these more advanced alternative testing methods. It's making it possible for companies that couldn't do drug testing for a variety of reasons to be able to get into drug testing. And so this is a pretty exciting time. Anyways, with that, thank you to OraSure Technologies and to Red Planet Substance Abuse Testing for co-sponsoring. Thank you, Grant, for joining us as our panelist today. And with that, I will turn the conclusion over to Jessica.
Thank you so much, Bill, and thank you for those who helped participate on today's webinar. On behalf of OraSure Technologies, we hope you have found today's presentation informative and helpful. If you asked a question today that was not answered, a representative will contact you to answer your question via email. Any other questions that you have relating to today's topic may be submitted to info@currentconsultinggroup.com. That's info@current, C-U-R-R-E-N-T, consultinggroup.com. Please use the subject line OraSure's Oral Fluid Webinar so that we can ensure that your questions are answered. This presentation was recorded, and you will receive instructions informing you how to access the recording. Thank you for your attendance today. This concludes today's webinar.